There is an average of 110 cases of botulism reported in the United States annually. 70% of these cases are infant botulism. The average age is of 13 weeks with a range from 1 to 63 weeks. Boys and girls are affected equally. Infant botulism was first recognized in 1976. Since the 1980s, infant botulism has been the most commonly reported form of botulism in the United States. Infant botulism is a sporadic disease. While it is a serious illness for the affected child, it does not pose a public health threat because it is extremely rare and has no epidemic potential. Infants hospitalized with this disease tend to have higher birth weights and more often born to mothers who are Caucasian, older, and have a higher education level. Affected infants are more commonly breastfed and have histories of normal gestation and delivery with no congenital abnormalities. Clustering of each case of infant botulism has been noted in some suburban areas in the eastern United States and small towns and rural areas in the west. Infant botulism occurs when the C. botulinum spores germinate and produce toxin in the gastrointestinal tract of infants. There is no person-to-person transmission. The risk factors and vehicles of transmission of the C. botulism for most cases remain unclear. A survey of foods fed to infants revealed the specimens of corn syrup as well as honey, but in no other category of the food tested. Investigators have noted environmental conditions might expose infants to environmental sources of C. botulinum, such as vacuum cleaner dust, soil nearby building construction, dusty or windy locations. These exposures, however, have not been fully evaluated by control studies. There are 110 cases reported annually in the United States. Over the past years, the cases for wound botulism has been between 30 and 40%. The average age for patients is 41 years with a range from 23 to 58. The majority of those affected are female. Since 1980, wound botulism cases have occurred in persons who use illicit drugs. These cases were mostly associated with needle puncture sites, but rarely with nasal or sinus lesions resulting from chronic cocaine use. Virtually all cases in the United States occur in the western states, primarily California. Though the 1980s and 1990s, the incidence of wound botulism has increased due to the increase in the use of heroin, especially in California. Wound botulism occurs when C. botulinum spores germinate within wounds. There is no person-to-person transmission. Prompt diagnosis and early treatment are essential. Botulinum antitoxin should be administered as soon as possible. The antitoxin does not reverse the paralysis, but it arrests its progression. Before the administration of this antitoxin, skin testing must be performed for sensitivity to serum or antitoxin. After skin testing, the administration of 1 vial of antitoxin intravenously is recommended. There is no need to re-administer the antitoxin since the circulating antitoxins have a half-life between 5 to 8 days. The recovery follows a regeneration of new neuromuscular connections. Between 2 to 8 weeks duration of ventilatory support may be required in more severe cases. Out of the 110 cases of botulism reported in the United States annually, 25% of these cases are foodborne botulism. Mean age of infected people is 46 years, with a range from 3 to 78 years. Men and women are affected equally. Foodborne outbreaks have been reported in 46 states, Puerto Rico, and Washington, D.C. 5 western states, California, Washington, Colorado, Oregon, and Alaska, have accounted for more than half of all the reported foodborne outbreaks since 1950. Foodborne botulism is a distinctive public health problem among the Alaska Native population, in which the majority of botulism cases have been associated with improper preparation and storage of traditional Alaska Native foods. Foodborne botulism follows ingestion of toxin produced in food by C. botulinum, and there is no person-to-person transmission. One of the largest outbreaks of botulism in United States history occurred in Pontiac, Michigan. Customers of the Trini and Carmen's Mexican restaurant reported symptoms of food poisoning in March of 1977. The cause was tracked down to a hot sauce made from improperly canned jalapeno peppers. The restaurant had recently switched from fresh to canned jalapenos. Within days, the restaurant closed and the jars of contaminated peppers were seized. There were no deaths, though 58 local residents and one Ohio visitor did become ill. Another one of the most widespread botulism outbreaks in U.S. history started in a New Mexico country club in 1978. Members and guests reported symptoms of botulism poisoning, later traced to the canned three-bean salad served at the club. Of the 33 who became ill, 2 deaths resulted. Lawsuits were later filed by the victims against the Joan of Arc Company, the Delaware food manufacturer that made the contaminated three-bean salad, and against the distributor Johnson Food Company.